Hey, Dr. Richardson here at Texas Facial Aesthetics. We're doing another non-surgical nose job procedure today, and just wanted to sort of explain how we do this and give a little overview about how the procedure is performed. So there's a lot of different indications for the procedure depending on the patient's anatomy. In her case, we're treating a little bump on the nose, a very subtle dorsal hump, we would call it, but she's an excellent candidate for this. So we're going to use a little filler to camouflage the bump on the nose, and she'll get an excellent change, a beautiful result here in just a few minutes. There's a variety of different ways we can inject the nose. I'm going to use a cannula for safety purposes. I think that's a safe way to do this, although I do occasionally use a needle for injections as well. But basically, we're just going to let you kind of get a view of what we're doing here, and we may talk a little bit through it as we go. Break here for a second. How are you feeling?
I do really good.
Okay, good.
It's just like the noises.
So you can see that we've already mostly corrected this dorsal hump. So she's got a little hump here that we're trying to camouflage. Little tiny pinpoint bleeding, but very normal. So we've just injected above that. We want to be careful not to over inject this area so that it still looks very natural. But already her contour of her nose is much better than when we started. Trying to give her this straight profile or even a little bit of convex or concave curvature there to counteract some of the bump. Before we started, we used some topical numbing cream, some lidocaine and benzocaine and tetracaine cream. And that just makes this more comfortable for the skin. And then before we make any punctures in the skin with any needles or cannulas, we prep the skin to make it antiseptic. So we use an alcohol pad and we use a benzalkonium chloride pad. So it is possible anytime you pierce the skin with a needle that you could have some bruising, and patients generally will get a little bit of swelling with this, but generally bruising and swelling are not major issues with the filler injections in the nose. So you can see I do a little bit of sculpting along the way, and we do some sculpting to make sure everything looks nice and smooth and stays exactly where we want it. This is looking very pretty so far. Not hard to see on yourself, that profile view sometimes.
Oh yeah.
Much improved.
I can already tell. Wow, that's crazy.
Yeah. It's fun to see that immediately.
Will you have to do anything to like the tip, or you just kind of
I'm trying to
focus
figure
in?
out if I want to put a little bit.
I kind of wanted to like go up a little bit, but
Okay.
I don't know if that'll just completely change everything.
I don't think so. I think you could actually use that just a little bit. So I do a lot of sculpting. This product is generally very malleable, so we can move it around and get it to go where we want it to go and stay there. She's got a little bit of swelling around her injection side, but very minimal. Okay, take a look. I'll let you take a look at it. I think you're looking
Yeah.
very nice there.
I like it.
It's very natural, very pretty. I would say that's a good stopping point, okay? Typically, I'll see patients back around 2 weeks post-injection, so that's a good time to reassess, and if we need to do any touch-ups, that's a good time to do it.
Okay.
That allows any swelling from the injections to sort of resolve and allow us to just reassess, and most of the time we don't have to do anything else, but if we want to do any touch-ups, that's the time to do it.
Okay, cool.
Okay?
Yeah,
So that's a
great.
non-surgical nose job procedure using filler.